Hi, this is Erin from Revive, and today I'm going to talk to you about clinical Pilates for low back pain and some key principles for active recovery for you. As you may have worked out from the previous slide, people can be a bit stiff in through their back sometimes, especially if you have a long history of pain. The next principle is spinal articulation, and what that kind of means is our back can move bendy as it is designed, given we do have a lot of vertebrae stacked together to facilitate that, instead of stiff, which is how people do tend to start moving after years and years of back pain. What we do tend to find is because you've had pain, your muscles will spasm and try and splint the area, which for a short-term strategy is okay, but long-term it's not really effective. What we find is because you get stiff and guarded, you don't tend to move. And when you don't move, you remain stiff and guarded, and it becomes a little bit of a feedback loop. What we want to try and do is get people to, again, relax the muscles that don't need to be on and try and get some movement back in through the spine. What can happen is while we think that we're stiff like this and not moving and maybe not loading anywhere, that's not very realistic. And what actually tends to happen is one area takes all of the load instead of all of the spine, encouraging and getting a bit of a chance to take load. How we do this is we start with some assisted movements. So obviously within the Pilates studio, we have the springs on the reformer, the trapeze table, or even with the Wonder Chair. And we also can make use of TheraBands. And we would use those springs to assist you in getting an articulated sort of movement. So whether it is starting quite basic with a cat-cow sort of motion on the mat, or progressing to the roll down on the trapeze table, or some sort of assisted sit-up. In those situations, you're using the spring. So rather than having to use your own abdominal muscles, the spring is allowing you to really focus on getting that bending and rolling in through your back. With time, we would progress you to being resisted with spinal articulation. And what that's going to do is it's going to simulate what it's like in real life, because often when we are doing these sort of rotational bending motions, it is against some degree of force, and that's when we tend to injure ourselves. So by practicing that within the clinic, you can build your strength out in the community. We also have lumbopelvic dissociation, and that's honestly a lot of words, and what it really means is trying to teach you that your back and your hips and pelvis, they can move independently of each other. Again, to reiterate the same thing again and again, what can happen if you do have low back pain is you have learned and protective pain mechanisms. It means that rather than being able to move nicely through our back, as per the articulation slide just before, we get stiff and we get guarded. So anytime we want to try and move through our back, it's also very likely we're going to move through our hips and pelvis. Or if I'm just wanting to move in through my hips and pelvis, I might actually move through my back when I'm not meaning to. This is a lot about more of the brain-body connection as compared to a true stiffness in through an area. The idea is we're trying to retrain the body parts and your brain to get better at coordinating it so one area can stay still and isolate while the other is moving. If you've ever done a scooter or knee stretch, these are really excellent exercises that do work your lumbopelvic dissociation, because they're wanting you to maintain a neutral spine as your legs are moving on the carriage of the reformer. As with everything, we really like to start you in more of a neutral position with this, but as things progress, you can be in different postures depending on what's required for your life and your activities. But the main thing we find is making sure that when you lift your legs, you're not going to slump through your back. And when you're pushing your legs down, you're not going to overarch, because that can cause a bit of stiffness, bit of niggling, and a long-term capacity for people. The first principle I'm going to talk about is core control. As you can see in the image here, we have a number of different core muscles. There's actually 4 different layers that we might specifically talk about. More superficially, we have your rectus abdominis, which runs from your ribs down to the top of your pelvis, and that does that kind of sit-up type motion. We then have the obliques, the internal and external, which run from the ribs down to the side of your pelvis, and they do that twisting and side bending. And deepest to that, we have the transversus abdominis, or the TA. How that one works is it actually runs in a transverse fashion, funnily enough, around the back, and when it contracts, it forms a bit of a dynamic brace. What that means is you can have that muscle contracted but still be able to move. What we find for people who do have lower back pain is historically when they've been at a gym, for example, they might have been told to brace through their core as they're doing exercises. The issue with this is we find out that people tend to be a little overactive, if anything, in through these superficial muscles rather than having just the TA turning on. The thing that we're wanting to try and do within the Pilates sessions is get you to relax the muscles that do not need to be working while maintaining that minor contraction of the TA. How we do this is we like to start with people in a more neutral spine position, so without too much arch or bend in through your back. And then as you progress and you're building strength, and of course, dependent on your goals for exercises or activities, we can then get you to be doing that core control, whether you do have more of a bend in through your back or if you're in an arch position. So that arching position is especially relevant to, say, those in dance and gymnastics backgrounds. The final principle we'll talk about today for low back pain is glute stability. If we think about how we are designed, we've got that nice pelvic girdle, legs come out underneath, we walk around, and on top of that stable pelvis is the rest of our body. We have a lot of stability inherently in the glutes and in through the pelvis just by way of how the bones and the ligaments are structured together. But for those who maybe are hypermobile and don't have as much of that passive stability, there can be a lot of issues if they don't have any strength through the glutes. Or if someone has had a lot of lower back pain and they have potentially had those protective mechanisms, they might have actually been developed ways to move when they're not really engaging a lot in through their glutes. So the goal of the Pilates is going to be to try and build the strength through there. By having nice strong glutes, it gives that active suspension, active support in through that pelvis and gives what we call forced closure. It means that everything can stay nice and locked together so that as we are getting around in our average daily life, everything is going to be well supported. By doing this, we have a really nice base. So whatever movement we need to do higher up in the chain, so whether it's through our back or even in through our shoulders, we have that support because we've got a nice strong pelvis. It's also important for unilateral movements. So again, I walk. I presume a lot of other people are going to be doing some degree of walking across the day. Steps and stairs, things that are going to add load in through one side of the body at a time. It's really important to make sure you have adequate stability in through the glutes. If you don't, it might mean that you have a bit of a compensatory pattern with how you're walking, which might mean you're doing some funny movements in through your back to try and keep yourself balanced, which can feed into that loop of having back pain. So the idea is nice strong glutes, you can move around, you can be stable, and you can reduce some of that pain that you might be having. So that concludes our little presentation today on lower back pain and clinical Pilates, and hopefully that's been really helpful and informative for you. The main thing I want people to take away is when we do these programs, we're not just pulling it out of nowhere. We do think quite critically about what your goals are. We think about what sort of movement deficits you might have, and we're giving you exercises to try and correct these. Sometimes it might just be getting stronger through certain areas. It might be loosening up areas that maybe are a bit stiff by way of stretching. But a lot of it is also trying to work on developing that brain-body connection. And that's why with our clinical Pilates, they do have that really nice ratio of therapists to people in the group to make sure you can have that attention, you can have that supervision and support. By doing the Pilates as we do here at Revive, it's more than your usual exercise group. It isn't just giving you the same cookie cutter as everyone else and expecting you to do it completely independently. We're really wanting to make sure that you can also understand why you're doing an exercise, what the goal is, so you can learn how to have better movement strategies that can translate to reducing pain and feeling more comfortable as you get around in the community. If this has been interesting, informative, you'd like some more information, please do reach out to the clinic and you can have a chat to one of our physios today. Thanks.